Dear Dr. Raghav Yelamanchi, I congratulate you for taking a topmost rank. That is rank number 1 in MCH Surgical Oncology in NEET SS 2021. And it's a fantastic, fabulous, topmost rank is nothing beyond that can be achieved. But one thing which I am very clear, I am here to congratulate you, and the entire team here is to congratulate you and wish you and greet you for determination. But one thing which we are looking up to you is your attitude. What is that? Very rarely I see the mind stronger than exam, and the mind stronger than the examination board, and the mind stronger than what exam gives, and the mind stronger than what if exam gives and the seat is achieved through that. And even stronger than that is what I want, and even stronger than that where I want, and even stronger than that where I want, when I want, and even stronger than that, this is the time I want and this is the time I to take. Brilliant.
Thank you, sir.
And very strong mindset and excellent. I don't have words to appreciate you, and I don't have, I'll tell you, I don't have enough of mental strength that you have. In fact, I'll tell you, I believe strongly in, and that's the reason why I try to motivate a lot of people, push a lot of people to next stage of life. If someone is going to ask me, if you have asked me, sir, should I leave this AIMS rank number 3 and should I prepare for NEET SS, I would have definitely said no. Probably I would have said that same only, I believe so. But, and also I remember very well you have been answering in the chat box, and I was little shocked, and I was also not happy. In fact, to be very honest with you, and because why he is still studying, why he should do it, and why he is taking this pain.
I strongly believed in consistency, sir, always. I've always believed that even a topper is one, if whatever happens the previous day, whether it's good or bad, whether we may be the ranker in the previous exam, or we might not even qualify for the previous exam, but I strongly believe the next day we have to be afresh, start early, go to the library, pack your books and start the day afresh. Whatever happens the previous day, whether it is fully motivating or we are fully depressed, the next day is ours and we have to start afresh. And if we continue to do those kind of effort in every aspect of life, I think success will be ours and the rest is history.
See, I made a video 2 days back. The video says, if your scores are less, don't settle for less. I don't know whether you have seen this video or not. This video I published.
Okay.
The meaning of the video is, if the scores are less, don't settle for less. That means, if you are not satisfied with the existing scores, don't go and join. But I meant on a broader perspective. But when you look at it, for every individual, it suits. For the reason, for you, though you got rank number 3, it is less for what you wanted and where you wanted. And then you don't want to settle, and you are worked for to the next level, and this is what you wanted and that you have achieved. And that means it's a story, and it's a strong message for each and every one of the students who is looking into the video. Kindly understand that if you determine this is what you want to do, nobody can stop. And here the standing example, I'm telling you, here the living example is Dr. Raghav Yelamanchi. And I'm telling you, these are very few personalities like this that I have come across. I have come across like Dr. Raghav Yelamanchi, but not very frequently. To have a very strong mindset, if I do, I'll do only this. Yes, and I really appreciate. And people don't, he doesn't feel that he does not want to take what is given to him, and he will take what he wants. And that's what he has done right now. And now the stage I have not still given to him, now I am giving to him, and whatever, there is no interview today. And there is nothing I am going to ask questions. Already I asked so many questions previously and he has answered those. Now, whatever he wants to talk and whatever he wants to speak, And he will speak, the interview will conclude with that. To Dr. Raghav Yelamanchi.
Yes, sir. First of all, I would like to give a small message to all my juniors. In the previous videos, I've been very clear about my preparation tips and like what to prepare, like how to study and what to do. So basically, I was also previously telling that preparation should start early, and just not starting early. One should be very consistent in their efforts. It is like we allocate a particular time every day, and we have to inculcate that habit of reading every day. And that usually, if not tomorrow, some other point of time, it will reap the results. And hard work is the key. And I strongly believe that everybody can do what they want at any point of time. Only what we need is hard work and consistency. And among all this is what we have to believe in ourselves. Even if we do hard work and we are consistent in our efforts, if we don't believe in ourselves, we cannot achieve what we want. And once we are done with all this, then success is our cup of this thing, and we can create history by our name.
Are you done?
Yes, sir. This is the only small message I want to give to my juniors.
See, kindly tell me where you get this mental strength from. Suppose I am asking you a question, little hypothetical. Suppose this exam, if you have got, say, rank number 30, instead of rank number 1, even not 24 also. If you have got rank number 30, if I say, what would you have done?
I want to narrate a small example before incident what happened before exam. Just before 1 day before exam, I started having fever. I was in Delhi at that time. I started having a running temperature. It was around 102, 103 degrees Fahrenheit. And like even I was not able to sit on the chair to revise or prepare. I was lying on the bed. And at that time, the Delhi was recording about 1 degree Celsius on the day of the exam in the morning. I was alone in my room, away from my home, preparing, and I couldn't even wake up the morning of the exam. So I just had one thing in my mind, to just get up and go to the exam. And I felt only one thing. If I was happy with my efforts for the exam, whatever the rank, what I get, I would be happy. So I pulled myself. It took nearly 1 or 2 hours to just stand up out of the bed, gain some strength. And I took a little paracetamol and I went to the examination. I gave the examination, really sat. I don't know like, how I sat in the examination center. And after that, I directly went to the COVID lab and got tested and was COVID positive. Thanks to the NEET that there were some few isolation centers also to write during the time of symptoms. And I was pretty much sure the kind of effort like I put in that particular situation, I was happy with that. Whatever the rank it has come, I was happy with that. So what I advise everyone is to act according to the situation. It may not be our best effort, but depending upon the situation, we have to do the best what we can do. And there is no point of regretting. If we feel that we have not cheated ourselves or we have done our best for that situation, there is no point of regret. In that sense, even if I get rank 100 or don't get a seat in NEET SS, for my efforts I put on that day in such a situation, I'm very happy, sir. Even just before the results also, I'm very happy.
Now my question, my two things in this I want to really appreciate. One, I mean, you're not well and you said you are COVID positive and you had an isolation ward, and in spite of it, you went and gave the exam and it was a successful exam. But what was running through my mind was, last year, during mid of December or January, I became COVID positive, and in spite of being positive, I was just taking paracetamol and I was taking class. And one class I was not able to do, and that one day I cancelled, and subsequently I came back and took a class. That I felt very committed, that in spite of my illness, I did justice by taking a class because I didn't cancel the class for students.
Yes.
I thought in me that itself is great, but as a student who is not well, and here already you have a seat with you, already it's very comfortable, and still in spite of it, and you took this exam, you gave importance to this exam, and you gave respect to this exam, and you went and whatever the illness, but mentally you want to go and give the exam, you gave the exam. well disciplined. There is no second thought about it, and there could be no bad situation than this. And you are not well and going giving an exam. What more can be there?
It was the same situation for many people also, sir, around me. That was the peak time in Delhi. The cases was very rising, and almost half of the people were positive on that day.
So, in spite of it, you felt important, because for others this exam is important. For you, I mean, when from looking outsider like me, this exam is not important. I'll tell you, because already you have a third rank in NESS, already you have a seat in AIMS, already you are assured. And if I was in your position, okay, I would have given this my illness as a reason to escape out of this exam. I'm telling you very frankly, because I have a reason to say. But you didn't take that reason, and you are strongly prepared. I want to do in Tata. Then this is the way. I mean, I have done it, and I have to give this. Now, my question is not that. My question was, I mean, if in case the rank has jumped beyond the seats which are available in Tata, and what you would have done after that, you would have still continued in AIMS of the third rank, or you would have given the subsequent exam of NEET, which is going to come in June, July, but still to go and pursue the seat in Tata?
Definitely, I will join AIMS, sir, but I would definitely give the next attempt in NEET also for Tatas. I would not leave that till I achieve that.
Perfect. So, and this kind of determination, and very precise determination. How are you able to build it? I mean, mentally, how are you building it? It's easy to say. I'll tell you, it is easy for me to say. Anybody can say. But anybody to put into practice and prove it is the most difficult. I'm asking you. How are you doing it?
So it usually comes by practice. It's not a very easy task. I strongly believe in you, sir. It is not a very easy task. It will not achieve success or this level of determination from the first step itself. Initially, we might fail to achieve what we want, and we have to continue that. We should not stop until we pursue all our goals. And we will experience failures, definitely. We have to learn from them. And what I've learned in life is also to see every opportunity in every situation, whether it is positive or negative. We have to search for an opportunity and utilize its opportunity just to bounce back again. And by this consistent efforts, we can improve the level of determination what we have also. And the necessity is what that creates the path for this level of determination. I was destined, and I was seeing people of oncology, people like patients suffering because of lack of dearth of services. And I wished I could do some help or bring a change for them in the treatment practices, or at least bring the best care, or do some research and prove what I can do for them. So that was a force which is pushing me, and that was one of the strong reasons for my strong determination to go into Tata, sir.
Very good. And can I ask you? I mean, it is that enormous amount of the self-confidence that you have, and that you believe in yourself, and you believe in your hard work, makes you like this?
Yes, sir. Even my parents, everybody, and my professors, they are one of the these people are responsible for all of my self-confidence. Even my father would tell me only about one thing: to believe in yourself. That is the best confidence what you can have in your life. Whether you have read the entire for the entire exam or not, you have to first believe in ourselves before we go. And if we do that, then we can achieve whatever we want. Not only about the studies or whatever anything. Once we start believing in ourselves, we'll be happy about ourselves. And that is the best thing what we can achieve in our life, is to be happy about ourselves.
I'm really inspired, and I'm just learning from you. I mean, this level of this level of confidence. Because I'll tell you why. Because what you are doing is not simple. I'm telling you why. Because what is within my capacity and within my purview, within my house, I can do. This game is only I'm not playing. this game is played by many, and this is a mind play, and this mind play, the entire examination system also be a part of this game. And with that, to play with controls with me and to get what I want is not easy. is not easy, and because I know the entire game and I could visualize that, and that's the reason why I'm saying you this. And I mean, are you like this only now, or even for post graduation, or even for MBBS was also you have been like this?
No, I have not been like this, sir. It is like definitely like change is the only consistent thing. So obviously I was like everyone in the childhood, too naughty also, but still I improved. I learned from life. I learned from others. From every person, I take some few qualities what I feel very good in others. I inculcate in my own behavior or life, and these minute things, if I add on every day, then obviously will improve each day, and for it, every year will be a better person. And I search my happiness in others' success and even others' happiness. Even in that such a way, I love teaching others. I love teaching my juniors, and I feel happy when they start growing. When they start succeeding in their lives, and I see my patients improving, getting cured of their diseases, and that is the most important thing which makes me happy about this.
Beautiful. Beautiful. Now, what is that you are looking in? I mean, your aim is surgical oncology. I mean, you have gotten the place where you wanted, and eventually, after 3 years, you become a surgical oncologist. I mean, that's how the system is. After that, you have something in your plan. You might share, you may not share. I mean, that's up to you. But I mean, what are you looking at? I mean, doing this. What is that you want to do in this specialty, and what is your ultimate vision or path that you are looking in?
So my ultimate vision is to make cancer a curable disease. Of course, like still what we learned about cancer is a minute, minuscule of thing, and a lot much to learn. Every day it is evolving day by day. We are learning more about it, the various pathological process. We are getting new drugs, we are new surgical therapies. We are every day we are improving our level of knowledge, and thereby the amount of treatment, the kind of treatment what we give. And I strongly believe that when these efforts continue, one day definitely cancer will be a curable disease, and not a death, just a death stamp to the patients. And not only that, we have to make a world a better place for them to live, show them support, help them again come back to our society, again mingle with others, and at the same time even just promote the knowledge about cancer, even motivate others to pursue this career, help them do this, and finally the ultimate beneficiary should be the survivors of cancer and the patients of cancer.
Great, great. I mean, very difficult task, but achievable because you say that.
Not stop till it will be achieved.
Huh?
I will not stop this till it is achieved. Definitely.
That's what I'm saying. Very difficult task, but because you are saying, I'm telling you, it is achievable. I'm repeating this.
Sure, sir. I would be the most happiest person if it is achieved.
And you will do it, and you will be part of this mission. And the second thing which you said, and stamping of a patient for a death. Yes?
Yes.
That is the mindset of any diagnosis you give to a cancer patient. That means
Yes.
days are numbered. Whether it is curable or non-curable, I mean, that is irrespective of it. The minute any diagnosis, even for a curable cancer, the minute you go and deliver a diagnosis, the patient, he feels, okay, my days are numbered. And then immediately they'll ask, how long I'll live? Next question.
Yes. that feeling kills them faster than the cancer, I feel.
This will kill. And next, they will send the patient out, and the attendant will come. Attendant will come and ask you in very low voice, "Doctor, how long this patient will survive? In months or in years?" They will ask the dates, and you will not be able to even say what to reply for this question. Anyway, now, great, great to interact with you. I'm really blessed. I'll tell you. And once again, I'll tell you. I don't know. Will I be able to talk to you again in future or not? I don't know. But I'm really blessed to have students and like you, and I've been part of teaching you in some part of your life, and I'm really blessed.
Even I feel blessed to be a student of you, sir. Even you're such a great motivator, and even speed has been instrumental in adopting the change. You were very fast in like inculcating and reshuffling all the schedules, and like you always were with the students at the time of difficulty, and nobody has done that. You were directly available on WhatsApp for any queries and even doubts or even any difficulties, any counseling related queries, whatever it may be, and that we cannot expect from any other person or any other like institute or any other this thing. When we are very fortunate to be actually associated with you.
Because there is some skill which is there, which God has given me, is to something called a social entrepreneurship. This is called a social entrepreneurship. That means at any given point of time, for how many people you can assist to get them into the next stage of their career. Once you do that, the next stage of their career, and they will go to the next stage of the career, and they will deliver the best to the society. So this is a cycle that there is a whole lot of difference between entrepreneurship and social entrepreneurship. An entrepreneurship will develop a system and will make a system successful, bring upon a change in a system, and through that they will try to get the quality into the system and to make people migrate to the next level. So that's what I practice. People could understand, will definitely know what we are trying to do.
Yes, sir.
So and it's great and great interacting with you. And at this point of time, whatever you want to say, and you are free to say. And for sure, this video of yours, I wish that everybody could see, and truly an inspirational story of yours, and everybody should see, is my wish. And definitely for what all you want to achieve from now on, you know what to achieve, then you will do by yourself. So anything, a closing word you want to say, and with that we will come.
I just want to thank all of my parents, my colleagues, the Speed Institute, which has been with me from the past 1.5 years, and it has been exceptional in guiding me. And but my work doesn't end here. It's just a starting stone for another career, and the ultimate aim just is started just now, and I hope the results will be good, and the ultimate beneficiaries, I mean the patients, will be happy with my treatment, and that's the ultimate success what can I achieve. Thank you.
Great. Best wishes to you and all your family members and all people around you for great, wonderful, life-change career that you will adopt and influence many people's life and change in system that could be very useful for billions of people, not only in our country and also in the entire universe. Keep doing and keep moving, and your efforts will always will reward, and definitely you will be able to achieve. Thank you.
Thank you very much.